Hi, my name is Kristyn Robling, and today I will be presenting to you our research on person-centered language and ADHD research, a cross-sectional examination of stigmatizing language within medical literature. ADHD, or attention deficit hyperactivity disorder, is actually one of the most common neurodevelopmental disorders that's found in children. And there's often a negative stigma that's associated with ADHD. So children who have ADHD frequently experience negative impacts to their mental health and poor quality of life, as well as poor quality of care. Person-centered language, or PCL, has actually been shown to decrease stigmas and increase quality of care. So our goal with this research was to assess current literature over ADHD in children and determine how many of those articles adhere to PCL guidelines and how many do not. So we can determine if this is, first of all, a problem that we need to address, but then also see if it's a potential solution to reducing negative stigmas that are associated with ADHD and improving the quality of care that is given to children who have ADHD. We performed a systematic search of ADHD-related articles, and we did this with a cross-sectional study design. So we searched PubMed for any journal articles that contained ADHD-related terminology, and of these, we randomly selected 500 articles that were published between January 2014 and March 2021. And we assessed these articles for the use of pre-specified non-PCL terminology. And we did this to determine how many of the articles adhered to the AMA Manual of Style PCL guidelines. So here are our results. Of the 500 articles that we gathered, only 311 of them actually met criteria to be related to ADHD in children. The rest were associated with ADHD in adults or were not related to ADHD at all. And of those 311 articles, 180 of them did not adhere to PCL guidelines. So that's over half. And of these 180 journal articles, the most common terminology that was used was problem. So that would be in the context of problem child, problems with, and our second most common terminology was sufferer or suffers from. So sufferers from ADHD. And the third most common was mental, so mentally ill, mental illness. There were several other terminology that we found utilized in some of these journal articles, but by far problem was the most prevalent term that was used. So as I said, over half of the articles examined did not adhere to PCL guidelines, and it's been found that stigmatizing language from physicians has been shown to have a negative impact on the physician-patient relationship. This can negatively impact trust, and it just has a really bad effect on patient satisfaction. And so we predict that implementing PCL in medical literature as well as in clinical practice will have a positive impact on patient care, and it will also improve the satisfaction of patients with ADHD. And so future directions would be determining how we can implement PCL better into literature and clinical practice, and also the benefit that arises from implementing PCL in literature and clinical practice. Here are my references. Thank you so much for listening and have a good day.